Great. Thank you, Miriam, and good afternoon, everyone. Thank you for joining today. As Miriam mentioned, my name is Dan Borgasano. I'm Director of Product Marketing here at Imprivata. And today we'll talk about how you can unlock the full potential of the use of mobile devices at your organization, and particularly those mobile devices that are shared amongst your clinical staff, by implementing a robust access control strategy and some of the key elements of what a strong strategy should look like. But let's start by discussing mobile device adoption in healthcare and some of the associated security concerns. So as most of you know, your clinical staff continues to be mobile. They're moving throughout the hospital and from facility to facility as they care for patients. And as a result, the use of mobile devices in the delivery of care continues to increase. In fact, according to a survey from Zebra Technologies, the use of mobile devices amongst bedside nurses is expected to increase from about 65% today to nearly 100% over the next several years. And then similarly, the use of mobile devices by physicians is also expected to double in that time frame. And of course, this is because there are a number of benefits to the use of mobile technology, but some surveys show that organizations cited access to patient records, scheduling appointments, and then communication with colleagues and other clinical staff, as well as patients, as the top reasons for adopting mobile devices. And so as your organization considers mobile device strategy, there are a number of different approaches. So some organizations opt for bring your own device, but an emerging trend that we are seeing is one that many organizations are starting to employ, and that's the shared device model, where a clinical staff shares hospital-owned mobile devices in the delivery of care. And as you can see from this chart, about half of organizations using mobile devices use that shared model. So often these are purpose-built devices from manufacturers such as Zebra or Honeywell and others. These devices have a number of benefits, including increased durability. And in fact, some studies show that the vast majority of hospitals do not consider consumer-grade mobile devices to be durable in a hospital setting. But regardless of which mobile device strategy you employ, security is essential. So in fact, a security done by one vendor showed that 83% of respondents cited security as their #1 top concern when managing mobile devices, while 77% also cited data privacy. And so in a study by Zebra Technologies, the top response that IT executives gave when asked about potential barriers to mobile device adoption was data security concerns. And why is mobile device security such a concern? Well, as you know, data breaches in healthcare continue to skyrocket. According to the 2008 Verizon Data Breach Report, healthcare experienced more than 500 data breaches in the past year. That was more than any other industry and represents an increase of more than 80% over the previous year. And these breaches are costly. On average, a data breach costs a healthcare organization about $380 per record, which is more than 2.5 times the average across all other industries. And mobile devices are a large source of the problem. So Verizon's Mobile Security Index in 2018 found that 35% of healthcare organizations have experienced a security incident related to mobile devices, and 87% considered mobile devices to be a security risk. Yet, despite the risk, only 41% of healthcare organizations said they have 41% of healthcare organizations said they have knowingly sacrificed this security for efficiency, for expediency of business. They realize that they have not done enough to fully protect patient records and other sensitive data, despite recognition that mobile devices represent a serious security risk. So why is that? Why have they sacrificed security for efficiency? Well, as you know, clinicians are in the business of patient care, so they want technology that enhances their workflow, not gets in the way. So when it comes to implementing mobile devices, and particularly the shared devices and applications, there are a number of considerations. For example, these devices facilitate increasing mobility by enabling patient identity management, clinical communication, lab collection, and a number of other mobile workflows. But it's important to consider workflow and make sure that these devices and applications are usable so that you'll drive adoption and realize their full potential as a valuable tool in the delivery of care. Also, these devices are purpose-built for healthcare, and they put the power of technology in your clinician's hands at the bedside to automate a lot of workflows that were once manual. But because they are shared devices, how can you be sure that you're protecting access to PHI and make sure that only authorized users have access to specific applications and patient information? And because these are enterprise-owned devices, you have more control over their use and therefore improved security versus individual user devices. But, as is crucial in many areas of healthcare IT, how can you enable this security in a seamless way that does not create a barrier to patient care? So, how can you strike that balance between security and efficiency to protect PHI and give your providers the full capabilities of mobile devices and applications? There are a number of best practices, including deploying a robust access control strategy that takes into account usability. One of the most common approaches to improving device security is by implementing a mobile device management, or MDM, sometimes referred to an enterprise mobility management solution. Studies show that nearly 90% of organizations have an MDM in place, and with good reason. An MDM solution delivers a number of benefits, including visibility into what devices are in your environment, who is using them, and how they are being used. This includes having a comprehensive device enrollment process that allows you to manage the correct permissions and applications based on various user privileges. MDM solutions also help enforce security policies, including access controls such as password complexity rules and inactivity timeouts. And you can also use MDM solutions to remotely lock and wipe devices that are stolen or otherwise missing. But one potential area of concern when enabling an MDM solution and increasing device security is the user authentication component. So to truly balance security and efficiency for your users, you want to make sure this authentication is as seamless as possible. As we've seen on desktops, the repeated entry of usernames and passwords to access workstations, the EMR, and other applications can really frustrate your providers and create a barrier to care. This same challenge exists on mobile devices, and manually entering credentials into that small mobile form factor can be cumbersome and frustrating for clinicians, especially as you add more and more applications and enforce device timeouts. The result of this inefficient workflow could be workarounds, such as not requiring authentication, using generic PINs, or shared credentials amongst your clinical staff. But any one of these could compromise the very security that you are trying to enforce with these authentication policies. So Imprivata Mobile Device Access addresses this challenge by allowing users to tap their proximity badge to access their devices and then single sign-on into their application. Imprivata Mobile Device Access, or MDA, is healthcare's leading mobility authentication solution. It enables fast, secure access to clinical mobile devices and applications, and again, really we're talking about those devices that are shared amongst your clinical staff. Users can access devices with a simple tap of their proximity badge and then single sign-on into their applications. And that will give those clinicians the same fast and efficient and familiar authentication workflow that they currently experience on workstations and virtual desktops with Imprivata OneSign. As a result, you can unlock the full potential of these devices and applications by ensuring a fast, efficient workflow for providers while also maintaining and even improving security and auditability. So here's how the workflow looks with Imprivata Mobile Device Access in place. So Imprivata MDA will lock the device itself, and again, with a simple tap of a proximity badge, users can access the device. So this allows you to add security without creating a barrier to care. It also, again, gives clinicians the same experience they have when authenticating to workstations. So it should be very fast and familiar. And once the user taps to log in, they can then use single sign-on to access each application without the need to enter credentials. The user will select the application icon and instantly be allowed in. So this also gives you better visibility into who is accessing mobile devices and interacting with the apps and the PHI on them. And SSO will work for all users' applications, allowing them to switch between apps very seamlessly without cumbersome manual entry of credentials. So Imprivata Mobile Device Access will improve overall workflow efficiency for your providers and make it easier to add more applications over time because it really removes a barrier to and facilitates ease of use of the mobile devices and applications. So again, overall, by implementing Imprivata Mobile Device Access, you should see improved clinical workflow efficiency. You should also give more time to clinicians to focus on patient care instead of worrying about what their password is for each application each time they log in initially and then need to re-enter their password after they've been timed out. You'll also be able to improve security because you can enforce not only security to access the applications themselves, but a unique login to the device. So again, you know exactly who is using the device and what they're doing with it. And this should overall really help you drive adoption of mobile devices and applications in your organization as a valuable tool in the delivery of care. So with that, I'll now turn it back over to Miriam for any questions that you might have. Miriam?
Okay, great. And just really quick before I jump into the couple questions that have come through, I did want to mention that if you look on your screen in the chat box, I did list my name and my information. So if you do have any questions about what you've seen or heard here today and you'd like to hear back from us, please just send me a note. I put my email address in there, mlazardo@imprivata.com. So just make a note of that. And I also wanted to let everyone know that we will obviously be at HIMSS in February and would love to meet with you. So if you do want to schedule some time with us, please visit our registration page and you can select the day and time that works best for you. I did provide a link to that registration page there. So just wanted to make note of that, and I will go ahead and jump into some of these questions. So Dan, the first one that we have is, can Imprivata mobile device access be deployed with the Imprivata mobile device management solution?
Yep, it's a great question, and the answer is absolutely. So just like all of your applications, Imprivata mobile device access can be deployed through your MDM or EMM solution. It'll complement that very nicely. They don't have really any kind of overlapping capabilities. We're also in our newest version of mobile device access going to be enabling you to only allow the deployment of the mobile device access app to devices that are protected by your MDM. So right now you have the option of deploying it through your MDM or not, but if you would prefer for security reasons and to have better control to only deploy this to devices that do have MDM, you can do that in the latest version. So yes, they do complement each other nicely and really go hand in hand as part of a robust access control strategy for mobile devices.
Great. Another question, what happens if the badge is lost or intentionally shared?
So this is just like any desktop challenge that you might have in that respect. If it's stolen, then presumably you have policies for that, and you can decommission that badge and enable the user with a new one, both for your desktops as well as your mobile devices. Another way you can do that is by enforcing grace periods where a two-factor authentication is required. And again, this is similar to an option that's available on the desktop with OneSign. But also on these mobile devices, what you can require a user to do is enter two-factor authentication on initial login, say a PIN or a password, plus that proximity badge, so something they know as well as something they have. And then periodically throughout the day, maybe it's every 2 hours, 4 hours, 8 hours, up to you, you can ask for that two-factor authentication again, so that in the instance of a stolen badge, you'll know that user will have a limited time to be able to use that badge before they realize, hey, it's missing and they need to report it so and get a new badge. Someone who finds it will only have that limited window of actually being able to tap into the device.
Right. Can you enforce two-factor authentication on a mobile device?
Yeah, sort of I just addressed, you do have that option, right? You can do a PIN or password plus that badge tap upon initial login, similar to how you might do a desktop. MDA also will support just a PIN or a password if you'd like. So if users don't have their badge with them, they can simply enter their own unique password or PIN to get into that device, and Imprivata will know who that user is, and it will give them access to their applications and single sign-on that user in to their apps. Again, similar to the way that it works on the desktop. There's certainly value in being able to just badge tap in, but the ability to use only password, if you like, does still allow you to know exactly who the unique user is accessing that device instead of a generic PIN or no authentication at all.
So how is the SSO updated if the underlying password is changed periodically for different apps?
So this works very similar to how OneSign does on the desktop. The application will learn the new credentials once you change them, and the user will be single signed on in to those applications, just like they are on the desktop. So the applications themselves will continue to have their password expiration and reset and change requirements, but that will happen hopefully far less frequently and only periodically. And once the user does that, OneSign will learn those new credentials, and it will be able to single sign on into those applications.
So how can we integrate it with the iOS? What is that? I can't see it. Oh, it will work with both iOS and Android.
So that's a good question, and right now it is limited to Android-only operating systems, and that is across any devices that use Android. So I mentioned the Zebra or the Honeywell, but Samsung or SpectraLink, Bluebird, any others that use an Android operating platform, this will integrate with, and then of course the apps that are on there. We are working with Apple to integrate with iOS. And certainly if that's something you're interested in, we encourage you to contact Imprivata, and we can help us kind of build that case so that we can integrate with your iOS devices as well.
Okay, we do have another question here. There in the chat box. After secure access, what security is on the mobile device to prevent user from getting trapped from outside sources?
So I'm not sure I understand the question necessarily, but if you're talking about allowing that user to download or access other information, other applications, that's where your EMM or your mobile device management solution is going to come in, really give you control completely over what applications are on that device, and what applications and parts of those applications that a particular user can access. And again, we're really talking about corporate-owned devices here, so that should give you control over exactly, again, what applications are on there and what the users can do. And because if you add mobile device access, you'll know exactly which user is accessing the device, and then you can configure to give them access only to the applications that they should have permissions to use.
All right, great. I think that actually wraps up the questions. I did just want to remind everyone about that link in the chat box. If you would like to schedule some time to meet with us at HIMSS, please go ahead and click the link where you can register. And this session today also has been recorded, so we will send that out to all of you who have registered in the next few business days. So thanks again to everyone for joining us, and have a great rest of your day.